Welcome back to OMFS Essentials. Today, we begin a two-part episode focusing on the chemical agents that form the basis of our daily infection control, antiseptics and disinfectants. Using these agents correctly is essential for protecting the patient and ensuring the integrity of our surgical environment. First, let's clarify our core terminology. Asepsis. This is the process of protecting the patient's environment from contact with any infective organisms. Antisepsis. This is the process of killing or inhibiting pathogenic organisms, typically in the patient's environment or on living tissue. An antiseptic agent is a chemical used on living body surfaces to kill or inhibit microbes. A disinfectant is a germicidal chemical used on inanimate objects like instruments or counters to kill pathogenic microorganisms. 1. The aldehydes, high-level disinfection and sterilization. These are powerful chemicals, primarily used for disinfecting or sterilizing inanimate objects, especially those that cannot be autoclaved. Glutaraldehyde, example Cidex. This is a cornerstone of cold sterilization. Composition, a 2% acidic solution. Properties, it is a complete germicide, bactericidal, tuberculocidal, pseudomonacidal, virucidal, and fungicidal. Time, it achieves complete disinfection in 10 minutes, but requires 4 hours or more to become sporicidal, that is, to achieve sterilization. Uses, ideal for the tray system to sterilize heat-sensitive items like fiber optic endoscopes, lenses, catheters, and anesthesia equipment. Core selects. Composition, a combination product containing glutaraldehyde and a formaldehyde-releasing agent. Uses, used for high-level disinfection, 5% solution for 30 minutes, or sterilization, 10% solution for 5 hours. Formalin solution, formaldehyde. Composition, a 38 to 40% W/V solution. Uses, its primary roles are as a 10% solution for preserving biopsy specimens and as a 40% solution for operation theater fumigation. 2. The phenolics, environmental disinfectants. These are classic, powerful disinfectants but are strong irritants. Phenol, carbolic acid. Properties, a strong irritant and caustic that can cause skin burns. Uses, primarily as a disinfectant for inanimate objects. A 2% solution is used to disinfect OR tables, trolleys, and other surfaces. It is also used for the disinfection of sharp instruments, which requires 2 to 3 hours in pure form, and in specialized medical applications like chemical sympathetic block. Lysol, concentrated cresol solution. Properties, a dark brown irritant chemical. Uses, used as a 1 to 100 dilution in water for the sterilization, high-level disinfection, of sharp instruments, requiring a 1 to 2 hour soak. Instruments must be rinsed with sterile water before use. Dettol, chloroxylenol. Composition, a 4.8% chloroxylenol solution. Uses, a very common disinfectant for clinics and household purposes. It can be used as an antiseptic in a lesser strength. 3. The alcohols, skin antisepsis. Alcohols are rapid-acting antiseptics used almost exclusively on skin. Spirit, methyl alcohol. Mechanism, highly effective with an optimum concentration of 70%. Uses, disinfection of skin before injections, as a solvent to remove iodine after skin prep, and for cleaning the skin around wounds. Sterilium, composition, an alcoholic hand rub based on 2-propanolol, 45 grams, and 1-propanolol, 30 grams. Uses, a calibrated dispenser provides 3 milliliters of solution, which is rubbed on the hands for 30 seconds for effective hand disinfection. 4. Halogens and biguanides, primary skin prep. This group includes our most common agents for preparing the patient's skin for surgery. Weak iodine solution, tincture. Composition, iodine 66.2% in an alcohol base, 48 to 65%. Properties, a highly effective and fast-acting antiseptic, killing 90% of skin bacteria in 90 seconds. The alcohol base increases the iodine's permeability. Uses, Preoperative painting of the skin. It should be wiped with spirit after 2 minutes. Povidone iodine, betadine. Composition: a complex of elemental iodine and povidone, PVP. Properties: this iodophore complex makes the iodine stable, non-irritating, and water-soluble while retaining its broad-spectrum germicidal activity. It is extremely safe and non-selective. Uses: the modern standard for preoperative skin prep, surgical scrubs, antiseptic mouth rinse, and wound dressing. Chlorhexidine, hibitane concentrate. Composition: a 5% W/V chlorhexidine gluconate solution. Uses: diluted, 1 to 100, aqueous, for hand scrubbing, wound disinfection, and burns. 1 to 10 in 70% alcohol for preparative skin disinfection. 1 to 250, aqueous, for disinfecting equipment and furniture. Savlon, hospital concentrate. Composition: a powerful combination of chlorhexidine, 7.5%, and cetramide, 16%. Properties: it is both a germicide, from chlorhexidine, and a detergent, from cetramide. Uses: 1 to 30, aqueous, for cleaning physically dirty wounds where detergent action is needed. 1 to 100, aqueous, for general wound cleaning, burns, and storage of sterile instruments. 1 to 30 in 70% alcohol for preoperative skin disinfection. Critical precaution: when used for instrument storage, sodium nitrate, 4%, must be added to the solution to prevent resting. Summary: in this episode, we've defined the key terms of infection control and covered the workhorse agents. We use aldehydes, glutaraldehyde, and formalin for high-level disinfection and sterilization of delicate instruments. Phenolics, Lysol, and phenol for disinfecting environmental surfaces. Alcohols, spirit, and sterilium for rapid skin disinfection and hand hygiene. Halogens and biguanides, povidone iodine, chlorhexidine, and savlon for preoperative skin preparation and wound care. In our next episode, we will conclude our review by examining the specialized agents, oxidizing agents, solvents, astringents, and caustics. You've been listening to OMFS Essentials. Subscribe for Part 2, and as always, keep mastering the essentials.